This video will take you through detailed information you need to know about hair transplantation and provide an insight into Yemin's hair transplantation experience while showing the results 4 months later. Yemin is a registered nurse from Taiwan and was concerned about her receding hairline. For years, she used products such as anti-hair loss oils and shampoos, but her hairline continued to recede at the front. She decided to undergo hair transplantation through Seoul Guide Medical, as Korea has the most advanced hair transplantation clinics in the world. After you do an online consultation and video call, you come to Korea and undergo an in-clinic examination, with the procedure usually being done the next day. Initially, a computer scan will be taken to create a 3D model of your head. This scan will help the doctor to plan out the procedure, leading to better results. The doctor will then go over your needs and wants and begin his analysis of your situation. It's important to note that facial dimensions are extremely important when considering the amount of hairs needed for grafting. Your face is divided into thirds, the upper, middle, and lower third, as well as the left and right sides. Measuring the distance between these is important in the calculation to determine the best amount of hairs for transplant. You want to lower the hairline to its best looking position according to your facial dimensions. The doctor will draw the initial line and get your opinion. The line is not drawn straightly, but following the shape of your original hairline. When the hairs are transplanted, they will also follow the original hairline or an improved design, leading to natural results. For example, if you originally had hairs growing at an angle, the new hairs will also be placed in an angle. Another key point to consider is not just the lowering of the hairline, but the density of the hairs behind it. In many cases, your hair may be thinning out, and grafting new hairs into the area will lead to more volume in your look. You'll need to be careful here, however, because placing hair follicle grafts too closely together reduces their survival rate. Your doctor will determine how densely they can be placed in your specific case. Throughout our entire body, our skin can grow hair except on the soles of our feet, the palms of our hands, and our lips. However, hairs on different parts of the body grow differently. Thus, transplanting body hair to the head is possible, but the way it will grow will be the same as it grew on the body, which doesn't look good on the head usually. Thus, taking hair from the head is better, and there are several methods to choose from. The method depends on your case. In Yemin's case, the doctor recommended Follicular Unit Extraction, FUE. This method involves removing donor hair follicles from a densely populated area, usually the back of the head, but this depends on your case. The donor area is shaved, often in a large rectangular shape. Not all the follicles in an area are removed. The doctor will remove follicles which hold 1 to 4 hairs per follicle. The doctor will leave spacing between the donor follicles, allowing your hair to grow back naturally. Although the donor site will technically be less dense, in reality it doesn't look much different. There is usually a team of between 4 to 6 people working during an FUE transplant. The doctor removes follicles from the donor site using a super tiny 1 mm in diameter or less instrument, which creates a minuscule circular incision around the hair follicle to isolate the graft. The specialized nursing staff then go to work preparing the follicles for transplant by isolating them into groups determined by the number of hairs in each follicle. The follicles are then moved to another station where nursing staff expertly place them into injector units. Depending on the type of hair loss, the doctor will then strategically graft the follicles one by one. The grafting is done based on the number of hairs each follicle has, which ensures a natural outcome. This involves just as much artistry as science in order to get a natural looking result. It requires years of experience to master, and only an expert should perform such a procedure. PRP, platelet-rich plasma treatments, afterwards to promote hair growth should be done. Platelets are the body's first responders when it comes to healing wounds. When injected into an area, healing in that area is accelerated. After a hair transplant, a sample of your blood will be withdrawn and placed in a centrifuge machine which spins rapidly, separating blood components. The platelets are then extracted and injected into the scalp. Because these platelets contain proteins and growth factors for tissue repair, they can help to increase the survival rate for transplanted follicles. Although hairs start growing right away, they have to go through their own growth cycles. It takes between 6 to 12 months to get final results.
Guys, it's been 4 months since my hair transplantation, And this is the result. The grafted hair started to fall off 1 month after surgery. From month 1 to 3, some hairs fell out and other hairs came in. The follicles grow at different rates. I'm at month 4 and the hairs are quite long now. One cool thing about the transplantation was that the doctor implanted the hairs the same way they grow up. So if you look at my hairs, they're very natural looking. The grafted hair looks more natural after 2 or 3 cycles, and each cycle is different for each person. The hair strength after 4 months is actually very good. I can pull out my hair and it's very stable. I'm going to show you what the back of my hair looks like after 4 months. As you can see, it looks quite natural. I know it's thinner than before, but it doesn't look any thinner to me. I'm going to give you a very important tip. After the procedure, relax. Don't look at yourself in the mirror all the time. It doesn't help and stresses you out. Give your body time to heal and take it easy. And I have one more tip for you. Don't push to have the hair grafted too close. If you graft too closely, the survival rate drops. So listen to your doctor and follow the instructions. I'm super happy with my new hair and I feel much more confident.
Seoul is the capital of plastic surgery, skin, dental, vision correction, and other medical treatments. Seoul Guide Medical is here to find you the best doctors, the best procedures, and take care of you from start to finish. Contact us at consult@seoulguidemedical.com for a free consultation with our specialists. Let us take care of everything and create a customized treatment plan that is right for you. We help you with airport pickup, accommodations, in-clinic translations, aftercare, and hold your hand every step of the way. Visit our website at soulguidemedical.com for more information. Seoul Guide Medical. Happy patients, always.